We're all about facts here, not fear, right, Erica? And providing info to keep you and your loved ones safe. So between nationwide protests and the states opening back up, people are gathering as if there were no pandemic. President Trump's rally in Tulsa, Oklahoma tomorrow is expected to draw tens of thousands of people to the area, 19,000 of whom will be inside the arena for the rally, and many won't be wearing masks. So Dr. Kohli, you're joining us live. Hey, Doc. Whether or not it's a good idea, bad idea, indoor rallies, outdoor protests, even large gatherings, what would you say is the risk for attending?
So, Sam, I would say that a large gathering is really the perfect setup for creating a super spreader event. If you think about it, a lot of people from different parts of the community are close together. You're unable to do social distancing, maintain 6 feet of distance. You're shouting or cheering, which could be spreading your droplets. You're indoors if it's a rally, which we know is more efficient for spreading the virus. And contact tracing would be entirely impossible. But I want to take a minute to actually talk numbers so that people can understand just how real this risk is. So let's say 20,000 people are expected to attend President Trump's rally tomorrow. And we assume that 100 people show up to the rally with the infection without realizing it, which is a 0.5% infection rate, so extremely conservative. Now, we know that 10 to 20% of people who are infected are responsible for 80% of the spread. So out of those 100, you take only 20 that are actually spreading it. So 20 people need to be sick and spreading out of 20,000. And if each of those 20 people spread this to 50 other people, which we've seen to happen, then you're going to have 1,000 new infections. So you've gone from 100 people showing up infected to the rally to 1,100 people infected. And each of those 1,100 people will then take it home to their families and their communities. So the risk of infection at this rally is 1 in 20,
Whoa.
5%.
Whoa.
Man, okay, so if people do want to attend these events, now aside from a mask, what should people do to reduce the risk? And also, how effective is the thermometer checking in terms of knowing if someone's going to spread or not?
Good question.
So I would say, aside from the mask, Erica, social distancing, of course, helps. Being outdoor helps. But at the end of the day, my advice would be do not attend the rally because it's a high-risk event at a high-risk time like this. And a risk of 1 in 20 is a real risk. And you really have to ask yourself whether what you're doing is worth taking that risk. We know that temperature screening is one of the most insensitive metrics out there. In fact, in a study in the Journal of the American Medical Association, of hospitalized patients, 70% of people who showed up to the hospital didn't have a fever. So checking people who are not feeling unwell with their temperature, to me, really is not a sensitive metric at all for screening for the infection.
Interesting.
I'm glad you said that because my husband got one of those things.
The immediate
he checks every 10 minutes.
He could
he's
be
checking.
asymptomatic. I know. Come on now, Anthony. Come on. Some people might still be skeptical of how the virus spreads, Doc. So how do we know if people get infected from going to these rallies or even participating in protests?
Sam, we know because we've seen it. So choir practice in Washington, which was one of the initial outbreaks that we had, one asymptomatic person spread it to 52 other people. And this was a much smaller scale rally or protest, if you have, basically an indoor event where people were singing and close together. And we saw this also in a call center in Korea where 94 people got infected on the same floor just working together in a call center. So we know that it's going to happen.
Wow. Yeah, we reported on a young girl, or a young woman rather, that went out with her friends to a bar. You know this, in Florida, all 15 of them went to that bar. All 15 of them tested positive for COVID-19. Very scary. Thank you, doctor. We'll see you next week. So if you have a question about coronavirus you want answered by Dr. Kohli, write us on social media. You can also email info@dailyblastlive.com. No panic, just prevention and precautions.